being here.
Thanks so much for that introduction. I'm going to share my screen really quickly. Can you all see it?
Yes.
Perfect. Awesome. Well, thanks for having me today. I'm really excited to be here. My name is Erica Chang. I use the pronoun she, her, and I am the Youth Outreach Coordinator for the Hear Me Wa program at the Attorney General's office. I also have two members on my team who are also here. I'll let them introduce themselves before I move on. Amanda, can you introduce yourself, please?
Yeah, I'm Amanda Holfeld. I'm the Youth Programs Manager at the Attorney General's office.
You and Chevy.
Any pronouns? I am the Youth Program Outreach Lead for Hear Me Wa.
Thanks so much. All right, so just a little bit of background about Hear Me Wa. This program started with grassroots planning in the Tri-Cities when a youth started raising awareness about youth mental health and the high rates of suicides among youth in his community. He contacted his state senator, and together they collaborated on an idea of creating a youth line that youth can contact and get connected to resources in their community. In 2021, a bill was created, but it did not pass. It was written in a proviso that the legislature tasked the Attorney General's office to create a statewide reporting system for the safety and well-being of youth, as well as convene an advisory committee. A team was hired on, and they started researching other state lines and youth lines, contacting committee members and meeting with state agencies, law enforcement, youth-serving organizations, and more. In 2022 and 2023, the team focused on reaching out to youth to gain input on key features of Hear Me Wa and further develop a program that is informed by youth and designed to meet their needs. They contracted with Do Be Good, which is a human-centered design firm based in Seattle, to conduct workshops with youth to co-design bylaws and an implementation plan for the Hear Me Wa Youth Advisory Group. In 2004, the program launched, and there was a press conference in June. Currently, right now, we're working on program marketing and promotion. A little bit more about the program. Hear Me Wa is a program that receives and responds to reports regarding any youth safety or well-being concern. It covers a broad range of safety and well-being topics, including but not limited to harm or threats of harm to self or to others, sexual abuse, assault, depression, bullying or cyberbullying, substance use, and planned attacks. Hear Me Wa also provides support to youth by connecting them to existing programs in their community. It is available to youth up to the age of 25, and they can reach out to the program by calling, texting, using the Hear Me Wa app, or the website. We do not have a minimum age for the program, and if someone is 26 or 27 contacts the program, they'll still be connected to resources. They'll just be directed to adult resources in their area. It's important to know that support is available 24 hours a day, 7 days a week. And when youth contact the program, they talk to a trained crisis counselor from the Sandy Hook Promise Crisis Center. As the AGO implements Hear Me Wa across the state, we strive to be anti-racist, trauma-informed, and youth-centered. Youth, like I mentioned, can contact Hear Me Wa through various ways. They can call the program to talk with a trained crisis counselor. They can download the Hear Me Wa app and submit a report. They can send a text message to the program to get help, and they can also use the Hear Me Wa program website. When a youth contacts Hear Me Wa, like I mentioned, they talk to a trained crisis counselor at the Sandy Hook Promise Crisis Center. Those folks are the ones who investigate and triage the report, and based on the information provided, connect youth to services available in their community, or they contact a tip responder agency who can provide support to youth. This table right here has the names of all tip responders that may be getting reports from Hear Me Wa. They include 911, education services, such as schools, colleges, or universities, local law enforcement, 988, and regional crisis lines, and Child Protective Services. This is our flow chart. As you can see, we have 3 urgency levels, and the urgency level of the tip will define where the tip should go. Life safety are imminent threats. As examples, an active shooting, a suicide attempt, or weapons on campus. These tips are sent to 911, as well as education services if the situation is associated with a school, college, or university. Urgent tips are actions past, present, and future that can put someone in danger, such as child abuse or neglect, sexual assault, or harassment. And depending on the situation, these tips can be sent to CPS, behavioral health services, education services, or law enforcement. Critical tips are low-level threats. So these can include topics like anxiety, bullying, or general concerns. These tips will likely go to behavioral health services and education services, depending on the case. You'll see by the icon, those are how folks are notified. So phone, text, and/or email. As mentioned before, Hear Me WA connects youth to resources that already exist, which includes 988 and regional crisis lines. If we get a call from a youth with a behavioral health need that requires in-person crisis response, the crisis center will warm transfer them to their regional crisis line. The crisis center will also provide 988 as an additional resource after they speak to the youth and are able to de-escalate the situation. The crisis center uses existing searchable databases such as 211, Teen Link, and Teen Health Hub to provide additional resources to youth when needed. A little bit more about the work that's currently happening. We're continuing to do outreach to stakeholders and taking more of a regional approach this year. So the past couple of years, we've done a statewide approach. So now we're just being intentional about our outreach and reaching out to schools, law enforcement agencies, and ESDs. We're also reaching out to stakeholders that serve youth that might go underrepresented or disadvantaged, as some might say, throughout the state to make sure that this program is being equitable statewide. We're still convening our Hear Me WA Advisory Committee. So that is comprised of folks from behavioral health, public safety, school districts, higher education, as well as nonprofits. It also includes youth with lived experience. The advisory committee helps us review tip trend data, evaluates whether the program is being implemented equitably across the state, and proposes solutions for challenges that arise regarding program utilization and tip responses. They also help us promote the program. In addition to that, we also have the Hear Me WA Youth Advisory Group. They help our team stay youth-centered as we make sure that we create a program that meets their needs. They are compensated for their time and provide input on Hear Me WA's branding, marketing, and advertising, as well as program feedback. If you would like to promote Hear Me WA, here are a few points that you can share with folks. Hear Me WA is a free resource. It is a youth-focused line. It also provides live chat. If youth want more help or have questions, they can always re-engage with Hear Me WA. And all reports and tips are evaluated and sent to a broad range of responders and services for help. Finally, we'll be sharing more promotional materials with y'all soon. We're committed to continuing to improve this program. So if you have any feedback for us, feel free to reach out. You can sign up for a newsletter as well as send us maybe suggestions or concerns using the info hearmewa@atg.wa.gov email. You can also put it in the chat if you'd like. Like I mentioned before, if you do have any questions, feel free to reach out to us. Thank you so much. Any questions or concerns regarding the Hear Me WA program? Alice, it looks like you raised your hand.
Yes, I just had a clarifying question about the sending out of tip services, specifically in regards to law enforcement and child protective services. Um, I guess my question is, obviously there are mandatory situations where people need to be called and there isn't immediate choice around that. If somebody else is in immediate danger, if like there is an immediate child abuse situation going on. However, in a vast majority of cases, calling CPS tends to escalate a situation and not solve much. So I guess my main question is, when are those specific services mandatory to send out, and when are they optional, when somebody can choose? And where is the lenience for those gray zones in those areas where it's like maybe a CPS person does need to be sent, maybe their parents are abusive, but maybe it would be worse. So I think that the child's consent, the minor's consent, or the people's consent around these things, while can't always be accounted for, I was just wondering how they were accounted for in those specific situations.
For sure. So I can go over our terms of use with you, and then I'll let Amanda jump in as well. So when folks submit a tip, they are given a disclaimer. So it lets folks know terms of use of how to use the program. If it is an emergency, contact 911. If someone provides personal information in regards to the tip, that information can be used to resolve the tip. So that way youth are aware. It also talks about improper use of the program, things like that. Once they submit the tip, let me take a step back. There are 4 required questions on the tip form. The first one is event description. So the where, when, why, and how do you know? The event type or tip concern. So those range from bullying, cyberbullying, mental and behavioral health concerns, domestic violence, and the list goes on. The other question is the city and county that this particular situation happened in, as well as did this situation occur at a school? Once the youth completes the tip form, they are connected with a Sandy Hook Promise Crisis counselor who reads the terms of use to them as well. They also let the youth know that they are mandated reporters and if they would like to continue submitting the tip. Amanda, feel free to jump in if there's anything that I missed.
No, I think you kind of covered it. Our crisis counselors, like you said, are mandated reporters, but there is also the option for what information youth are providing when they contact us. So you have that ability to kind of stay anonymous if you'd like to.
Okay, yeah, that about answers my question. Obviously, the laws of mandatory reporting cannot be changed, but I think just letting somebody know that somebody is a mandatory reporter before something like that is divulged is really good. So I appreciate that. Thank you.
For sure. Thanks for asking. Any other questions?
Erica, in the chat, they want the link for the newsletter.
I can put that in there. Thank you.
And Erica, if you send that to me, I'll also send that out to the broader coalition in a recap email as well, so people can subscribe to that.
So thanks so much, Sarah.
All right, I'm gonna open it up. We have about 1 or 2 more minutes if anybody has any questions or comments.
I will also put our program website in the chat for y'all, so that way you have it.
VIC, you've got your hand up.
Yeah, thank you for that presentation. Like, it was great. I am curious, do you know like the age range of people that reach out to you? I just know a lot of, when I was doing casework, I knew a lot of teenagers that were really scared to reach out to these lines because of mandatory reporting. So I'm like curious how you're reaching teenagers or like in the high school demographic. Like, are you posting like flyers or anything like that?
Yeah, so if you would like a flyer, feel free to let me know. I can send those out to you. We also have handouts and things like that. So the past couple of years, we were getting points of contacts for school districts, law enforcement, 911, 988. So if a tip gets submitted and they needed to be contacted to the appropriate tip responder agency, we had um, their contact information, as well as an email and a phone number that they can be reached out to. We also have a outreach and engagement team. So there are two of us. We do outreach statewide. We're reaching out to not only school districts and ESDs, but also nonprofits, youth serving organizations, um, museums, after school programs, anywhere that a youth might congregate to share information about Hear Me Wa, as well as collect feedback. We also have targeted outreach to rural areas in the state, just because we know things, especially in populated areas, there's a lot of information out there for folks, but there might not be information in rural areas for youth to connect with. So reaching out to them. We also have targeted outreach, and I will also put this in the chat for you so that way you have this, to 16 youth categories. And just to name a few of them off for you, youth who identify as BIPOC, LGBTQ plus youth, neurodivergent, military, low income, and the list goes on. So also doing targeted outreach that way as well. Hopefully that answers your question.
Yeah, it does. I was just thinking, are y'all aware of like the McKinley-Vento program in high
Yeah.
school? Yeah, before I got enrolled in that program, the only way I knew of these resources was that my counselor reached out, and even then she was just like, this is a shelter you can go to. Like there was no other resources. So I'm wondering, like, are you only providing your information to counselors or teachers, and then if a student comes up to ask or they happen to, stumble upon a student situation, then they give the resource? I'm just like, is it like accessible where like anyone can see it? Like in a
Yeah.
yeah.
Yeah, so it depends on where the posters and flyers are being handed out to. So some of the flyers are designed to be in bathroom stalls. So if a youth does not feel comfortable using the information, it's still presented to them. We also have flyers like trifolds. So youth can also put them in their wallet, in their backpack, things like that. We're sending it out to anyone who would like a flyer. So if you would like a flyer, I can send those out to you. But they advertise them in different ways. Some are just on bulletin boards or community centers. Some we share in presentations like these. If there's an in-person event, I would love to attend and share information with y'all, just to get the word out there. So it just depends on what folks are looking for and how they would like to advertise it, things like that.
And I'll add to, just to build off what Erica said, we're also about to start doing some paid media. So there'll be like advertisements on social media and things like that. So it's hopefully not just, folks aren't getting information just from one source. It's kind of floating all around up there.
Yeah, that's awesome. Yeah, I was gonna say it's usually just numbers posted. And it's just like, do I call this number? Do I not? So yeah, thank you.
Yeah.
And then
And
before we wrap up, I did see one more hand up, and it was Alice.
Yeah, I just wanted to follow up on the point that V brought up, which I think was very good, that a lot of youth, even if they know of services, a lot of times won't seek them out of fear of mandatory reporting. And being that there isn't obviously something to immediately get around that aside from anonymity, is the anonymity advertised in these same flyers so that they know that additionally they do not have to put themselves at risk for that reporting?
I believe so. Like we have some points on there. And then obviously once you go in to actually use it, it'll give you more information on how you can stay anonymous.
Yeah, I think having something obviously in terms is really helpful. It's just important to understand people in crises are going to be a lot less likely to read a big terms of service page and read all of the like dotted lines and stuff. So when we're talking about accessible information that you can literally access and accessible information as what somebody immediately knows, those kind of operate separately in times of crisis, at least in my opinion.
Yeah, definitely. I appreciate that point. Yeah. I believe our materials do emphasize the ability to stay anonymous, but I would have to double check since they're just fairly new being created. I want to like dot my I's and cross my T's that we made that explicit.
Great. And again, if there are other questions, feel free to reach out. Erica, I'm sure people can reach out to you directly, and I will share this recording and all of the information as well as Erica's contact so you can all stay up to date on this. And thanks for the great presentation and the important work you all are doing. I'm really excited about it.
Thank you for having us. Really appreciate it.
Yeah, absolutely. And I'm going to actually go ahead and I'm going to keep the recording going just because you know how technology works sometimes, and I can always edit on the back end. We are going to next have Rachel Baxter from Healthcare Authority, who's going to be doing a presentation on updates for the House Bill 1929 housing programs. So Erica and the rest of office, feel free to stay on if you can. Some great updates are going to be coming from Rachel's way.
Can you see all right? I have it
Yeah.
on the presenter side, so I just want to
It
be
works.
sure. Okay.
Good.
So, hi everybody. My name is Rachel Baxter. I use she, her pronouns. I am the Transitional Aged Youth Behavioral Health Stable Housing Policy Lead for the Healthcare Authority within the Prenatal to 25 division. I also have with me Heidi as well. She's from our Contracts division, and I believe Lisa as well. And so they're the ones that actually work on the contracts and completed the procurements as well. So they're just here in case there's any sort of contract questions or anything like that that you might have. And with that, we'll go ahead and get started. So I'm going to be discussing the Voluntary Transitional Post-Inpatient Behavioral Health Treatment Facility Discharge Housing Program, also known as the Bridge Housing. The Healthcare Authority completed a request for proposals, which is RFP 2024 HCA 18 in December of last year. HCA's goal was to identify 2 facility contract providers, one on each side of the state. Unfortunately, HCA did not receive bids for the facility contract provider for the west side of the Cascades. So today we're hoping to share some information and answer any questions that you might have regarding the program and how to apply if you're interested. So I just wanted to have this disclaimer as well. For this contract, HCA does have the authority to contract with an entity without a procurement process, since we've already completed that in December. A lot of this might be a review. I know many of you have worked on this, so bear with me while we get through this first part. As you're aware, 3 out of 4 young adults in Washington state typically experience homelessness or housing instability. Across all systems of care, the need for behavioral health access and housing resource linkages for those leaving inpatient settings are high. Housing and behavioral health providers must respect the desire for young adults to live on their own. Transitional housing has been a persistent request by providers, families, and young people that includes wraparound behavioral health supports. Across all groups, easy access to an all-in-one space and outreach workers who can link young people with monetary and basic need programs, social supports, and recovery supports. During the 2024 Washington State Legislative Session, House Bill 1929, Section 2, subsection 4B established that HCA was to contract for 2 post-IBHTF discharge housing facilities and a community-based transitional provider, all of which shall work with a coalition of young adults with lived experience of behavioral health needs and housing instability. HCA completed a competitive procurement process to establish the facility contract providers and transitional support provider this past year. HCA has an apparent successful bidder for Eastern Washington and has identified North Star Advocates as the successful bidder for the transitional support provider. The Bridge Coalition and the lived experience of young people is an integral part of this work and is in alignment with legislation that was passed in 2023 within Substitute House Bill 1541, which states nothing about us without us. The governor's 2025 and 2027 budget potentially adds 2 more facilities, one in the northern part of Washington and one in the southern part of Washington, to expand these services and to help more unaccompanied adults. The post-IBHTF discharge housing program, also known as the Bridge Housing, is a step-down housing program from inpatient and/or residential behavioral health programs into a voluntary transitional housing facility program. The program is currently for unaccompanied young adults ages 18 through 24 years old to continue their wellness while working towards obtaining and maintaining safe and stable housing. The current funding for fiscal year 25 is to establish a voluntary interim housing facility with a 6 to 10 bed capacity to provide 1 to 90 days of temporary housing with safe, trauma-informed, and recovery-focused support for those who have already been discharged from an IBHTF and are looking to secure safe and stable housing. The program is intended to be community-based, supportive, and flexible to young adults that will reside there. The facility provider does not need to be a BHA. I will discuss funding for the program and the flexible funding component later in the presentation. The program is not intended to be an extension of an inpatient or residential treatment environment and will not be considered a secured or locked facility. It is the intent of this work that the facility providers shall work together with myself as the HCA contract manager and North Star Advocates as the consulting and technical assistance entity for the program. Consultation shall be provided to support the opening of the facilities, assist with immediate needs for young adults, creative problem solving if barriers are encountered, and to assist with young people to reintegrate into their communities and ensure that their lived experience and youth voice is in the program. North Star Advocates will not be providing direct behavioral health services for the program. The minimum qualifications of the contracted facility provider are: 1, licensed to do business in the state of Washington or provide a commitment that shall become licensed in Washington within 30 calendar days of being selected. 2, experience providing support and working with young adults with behavioral health needs. 3, active participation in a statewide coalition that advocates for a homeless young adult behavioral health work groups, and/or a similar work group. 4, has demonstrated experience in a leadership capacity working with young adults experiencing impacts of the intersectionality of state systems of care, such as foster care, juvenile justice, and inpatient behavioral health. Number 5, experience providing housing supports to unaccompanied young adults in need of safe and stable housing supports and services. The staffing for the program will be determined by the facility provider. The contracted facility provider should plan to have the program support staff and a designated resident manager in addition to peer support staff persons. A multidisciplinary team should be established or is accessible within the community. The facility provider will coordinate and support discharge planners and discharge plan recommendations, MCO care coordination, and the transitional support provider, North Star Advocates, to ensure an easy transition from inpatient programs into this less restrictive housing program. The contracted facility provider can subcontract with other community support providers to ensure young adults have access to outpatient services, crisis response, and peer support programs. The facility provider staff should assist young adults in ensuring wraparound services are available, in addition to employment support and resource navigation. Staff coverage should include at least 1 staff person on duty and awake 24/7. Again, the facility contractors may also subcontract with entities that provide behavioral health services to support young adults in the program if they do not have these programs already in place. So HCA plans to award contracts based on overall qualifications, experience, geographical reach, and ability to achieve the goals within the budget parameters. We're currently in phase 1, which is the start of the executing contract until June 30th, 2025, and will be for the initial facility startup, hiring, planning, outreach, the beginning of providing services, and establishing a working relationship with the transitional support providers and consultants. This also includes attending coalition meetings and trainings, in addition to implementing youth voice throughout the program. During the startup and implementation phase, the facility provider should establish an intake process, identify staffing, ensure access to core clinical services and psychosocial services, address safety and security, be in compliance with HIPAA, and protect the rights of individuals, ensuring young adults have access to social enriching programs and community integration, person-centered planning for return to community plans, and how the provider will ensure safe and stable housing is established and maintained once transitioned back into their community. Phase 2 will consist of program monitoring and reporting and will be the first completed operational year. The provider will continue to engage in the activities listed above in addition to continued outreach and engagement with the coalition, transitional providers, MCOs, and reporting on transitions and follow-ups with young people after completing the program. Young adults should also be invited to participate in the Bridge Coalition activities. As part of the draft contract, the contracted facility provider will also conduct pre and post participation surveys to ensure care is holistic, developmentally appropriate, and young adult centered, and determine if there's any gaps that are needed to be filled. B, collaborate and engage with discharge planners and housing support entities that serve young adults. C, facilitate facility contractors shall provide updates to myself as the HCA contract manager, as well as recording any trainings or connections to the work. D, the facility contractors shall submit quarterly reports and an annual report that will include demographic client data, as well as program narratives and self-reflections. HCA will provide the Excel spreadsheet and direction on how that data will be collected. Throughout each lifespan of the contract, the facility providers will be working and communicating with the HCA contract manager and North Star advocates. So for fiscal year 2025, HCA was budgeted a total amount to not exceed $1,177,000 for the entire initial term of the contract, which ends June 30th, 2025. HCA will have the discretion to adjust award amounts as necessary to meet program needs and so that the maximum funding amount is not exceeding and the most efficient use of the funding for the maximum number of facilities is achieved. An aggregated total of the $50,000 of the $1,177,000 is allocated for flexible funding, which is about 4.2% of the total cost. The current funding does expire June 30th, 2025. Starting July 1st, and ongoing through fiscal year 29, as projected, the contract facility provider will receive $1,008,500 total annually and an aggregated total of $50,000, which will be utilized for young people specifically to acquire safe and stable housing. More information regarding the allowable uses of flexible funding dollars can be provided and found within the draft contract language. It's good to keep in mind that this is a transitional housing program and is not billable to Medicaid and is not reimbursable per bed. The program should be offered to unaccompanied young adults who may not be Medicaid eligible. The amounts awarded be utilized for the participants. However, programs such as foundational community support, such as FCS, could be billed when applicable. So the geographic reach is important for this program. As stated within legislation, we're going to have the 2 on each side of the Cascades, and then there'll be north and south as well. Young adults discharging from inpatient facilities may be coming from all over the state and may need assistance to get to and from the program. Young adults may also need assistance finding employment and should be in the area that will allow for transportation to possible employment opportunities. This is especially true for rural areas. Additionally, throughout the state are areas that may not have as many social service and behavioral health programs that could benefit young people when establishing stability. It's important that the facility provider have a plan on how to mitigate those barriers. Young adults are centered in their own plans with their own individual needs, and their plan is more successful that way. This reduces the likelihood of recidivism into an inpatient facility, reduces visits to the emergency rooms, and gives the opportunity for autonomy and voice in their own future. The coalition will also give insight into their own perspectives on trauma-informed care, holistic care, recovery-centered support, and insight into the community services and program. The contracted facility provider will be expected to collaborate with North Star advocates and the Bridge Coalition for Education and Awareness. They will be also expected to connect with discharge planners and managed care organizations and housing providers that serve young adults to support the delivery of developmentally appropriate services and supports. So what are we looking for? HCA can contract directly without competitive procurement process, and we are currently seeking for June 30th, 2025 and ongoing, currently operating a facility in Washington State with 6 to 10 bed capacity and plans to use 100% of the bed capacity for the contract, has experience managing flexible funding programs, located in a geographical area that is easily accessible for young adults or has a plan for transportation needs, has experience working with discharge planners, has participated with or has experience working with young adults with lived experience of housing instability and or behavioral health needs, has knowledge of cross-agency programs and community providers, understands the need for young adult-centered future planning, trauma-informed care, developmentally appropriate care, and the importance of holistic supports for young people, understands the impact of intersectionality of state systems of care on young people, as well as how systems of care can also be impacted. So to apply, if your agency or you're aware of an agency that could be potentially interested for the west side of the Cascade Mountains, please submit a letter of interest to myself, Rachel Baxter, via email. The letter of interest should identify the interested facility provider with direct contact information. The letter of interest should also include how the potential facility provider meets the minimum qualifications that we stated earlier. Any additional relevant experience that would be beneficial to know for this program, such as experience working with discharge planners, utilizing or managing flexible funding, etc. Upon receiving the letter of interest, I'll provide a cost proposal Excel spreadsheet and draft contract for review and submission. Finally, if applicable, HCA will also ask the facility to provide and complete a readiness site visit. Prior to the visit, HCA will give a detailed list of what we will be reviewing at that time. I also do have a letter template that I'm going to be sending out due to some of the current events that are happening right now regarding Medicaid. I wasn't able to get that approval through our leadership currently. So still working on receiving that approval. And once I receive that, I can give that to Sarah to send out to everybody. On the last slide, you'll find just examples of letters of interest criteria, the FAQs that we received during our amendment, cost proposal spreadsheet, the actual House Bill 1929, as well as House Bill 1541, which is in regards to nothing about us without us, and an example of the RFP. And with that, if I missed anything, Heidi, feel free to speak up, or if anybody has any questions, I'd love to answer those.
No, this is great, Rachel. You're a procurement expert too. Just hearing you, it's like wow. It's just a lot of really succinct information, and you really covered it. The only thing, and this only came up lately, is that part of the, just spoiler alert on any kind of readiness site evaluation that we would do, that if you already have a DOH license, if you have the latest review that they did, that's really helpful for us, because then we don't have to duplicate work and we can kind of just see everything that's already been looked at. And so we're just really, ideally, somebody who already has a license, that's not going to necessarily be a showstopper long term. Right now we're looking at, spending money before the end of June, so we may be limited to facilities that have those licensures and have that information. But just to give you a heads up that information would be helpful. But we would address that after we receive your letter, and then we talk about the site visit and things like that. But great job, Rachel. And for everybody, it's really neat to hear about your program. Makes me real proud to be a state employee and see all the neat things that we're doing throughout the state.
I would also suggest too as well that even if you believe your organization don't meet some of the requirements, please feel free though to still place a bid, because then we can use your organization for future procurements and contracts. Have you guys in the system saying, hey, look, you might not be able to provide something now, but later on, you're able to provide the necessary resources we need in order to allow this contract to go through or the program to go through. So even if you don't meet one or two of the requirements, please feel free. Don't be discouraged. Please feel free to, place the bid, register. And, who knows, so long as you're in the system with us, we can say, hey, you meet requirements for future contracts. We would love to, work with you on programs that meet mainly your expertise too as well. So don't be discouraged if you don't meet one or two of the requirements, or even half the requirements, right? Like competitive bidding is competitive bidding here in the state of Washington. We highly emphasize in small minority owned businesses, those that are in BIPOC or in the LGBTQAI community, and so forth. So please don't ever be discouraged. Bid, and we will work with you guys eventually. It's just the eventually part.
Yeah, Lisa, that's so great. That's so true. We use sometimes the word the path. There's a path. Everybody's on their journey, but there's a path to legitimacy for everybody, regardless of where you are on that journey. It's just, yeah, when it comes to bidding, we're looking for, the most qualified right now. But these are client services, so they technically are exempt from a lot of procurement rules, but when we don't know what's out there, we do a procurement to maximize, cast a wide net and see who's out there.
Yeah, I just want to jump in and say thank you to all of you. Rachel, that was fantastic. And I'm going to be asking you for some of those meeting notes for my readout, and the rest of HCA crew. I also want to encourage those in the chat who are doing questions, and any providers, now is your chance to have a conversation with HCA. Any questions you have, I don't want to put them on the spot, but I would assume this is a time for dialogue if you are interested before you submit. So again, Lisa and Heidi, thank you for saying the submit. We want to see what's out there, but also providers, here's your chance to have a conversation. So come out of chat, ask your question. You're probably not the only one with that question.
Hi, my name is Luis Reyna. I'm with Northwest Youth Services, and we're based out of Skagit and Whatcom in Island County. I just had a question regarding, you mentioned licensing as being ideal to have licensing. What type of licensing are you talking about?
Go ahead.
Well, you go ahead.
Nope, Heidi, you're going.
I'll just go first. The reason why we said it's ideal is because we have money to spend by the end of June. That's the emergent issue. But for long term, we'll look at what we have and create a path from there. But ideally, a facility that already exists, it's for ideally 4 to 6 people, which is what the legislation says. If you have a facility with more than that and you can limit it to the 4 to 6 people, then we can scale it. What we don't have is something or I think if it's like less than 4, we don't have something to address that right now. So I don't think, based on just following the letter of the legislation, we're limited to, I think, 4 or more people, 4 to 6 or however, but I'll let Rachel speak to that.
You're correct. And that, really the licensing requirement was just that. We were looking at, I know Isaac is on the call as well. We were looking at other licensing requirements and what does Department of Health require, if anything, for transitional housing programs and those models. And we didn't see anything specifically. Since this is a community-based program, there's not that Medicaid portion. So we have different licensing requirements than maybe other facilities would have. And I wanted to acknowledge Ali had listed a question in the chat and said one of the things that I have a question was that when applying, you need to have a facility housing when applying. It was difficult as we did not have a place immediately designated. So yeah, we would need to have a facility. They would have to have a facility already in place at this time.
You also mentioned subcontracting with the behavioral health agency,
Mhm.
because we are primarily a youth serving provider that provides housing and care coordination services, but we don't have an in-house behavioral health team. Is there funding attached to subcontracting out with the local behavioral health?
So you would just receive that full amount. And so it would be up to you to subcontract from that amount with the behavioral health providers. The only request that we really have is that there would be peers that were on site, somebody that has the ability to call a mobile crisis response team or in case of emergency is able to call out, as well as offering those outpatient services such as peer support programs. So really you're able to do that subcontracting with an entity if you already have a working relationship with them.
Perfect. Thank you. And my last question is just regarding the funding. You said there's initial funding through June. After that, is it a 2-year funding, or is it like a guaranteed 2-year funding, or is it 1 year, or how does that look?
I can see Heidi getting ready.
Oh, and this is my recollections of our discussions with our budget analyst, and I recall that conversation saying that we had requested money for, I believe, 4 years total. So it would be up through what, 2027 or 29. And it's already part of a budget that we submitted to the higher ups and was approved last year. And it's documented, it's on the list, it's on the radar, but as people know, we are limited to what the legislature approves for each biennium. And right now we're at the end of a 2-year budget cycle. So if by April or May, we're going to have the budget approved for the next 2 years. And, when you're first in line and you're like, hey, we already approved this is the budget that's already been in, we're first in line, hopefully we'll get it, we're confident we'll get it, but then we have to wait another 2 years as well to do for the other biennium. But we've kind of locked it in as far as being good little planners and doing everything we are to get it on the radar and keep it on there. But we're at the limit and at the behest of the wishes of the legislature. So, but honestly, and I don't want to sound too utopian, but regardless of the administration, we've had a lot of support for behavioral health funding and spending, and the HCA, at least, I think, has a really good reputation for standing up programs and then finding other funding for it, and even having Medicaid cover it. So I really have a lot of optimism for what HCA can do with this. We're just limited right now to this. Yes, we're crossing our fingers. Yes, we're hoping it'll be another 4 years, or at least by the end of June, we'll be able to do a 2-year amendment for another 2 years of services, however that works. So it's a chance and it's a gamble, but it has a really good payoff if it all works out. Maybe.
It will. So I just wanted to touch on that a little bit as well. So we do have it as the biennium is how the contracts would be laid out. We do, like Heidi said, we already have it slated for 2025 through 2027 and so on. And it is that 1,008,500 annually. So that's per each facility. So not split between the facilities. That I will say that first initial amount is split between 2 facilities. So the startup costs, I think when we broke it down, was somewhere around 570,000, I believe. So just wanted to state that as well. But we do, again, like Heidi stated, we do have it slotted at least through 2029.
Awesome. Thank you for answering that. Just because I have you here, So between now and the June and the startup process and kind of hiring, getting programming in place, is there expectation to be serving youth then, or is that not until July, till things are kind of established?
So there, it would be ideally we would like to see you serving youth as soon as possible. But this period is for just startup.
Perfect. Thank you.
Yep. And I see Brian asked where he can find the slide deck, and I'll be sending that out to Sarah, as well as the letter that will include all the details that you should include for your letter of interest as well. And so I'm sure she'll get that sent out once that's approved on my end.
I will. Any other questions? Again, I'm just so thankful for HCA, for you all coming and doing this presentation and talking directly to people. And we're so close. So definitely apply, like submit it, go for it. It's going to be, I think it's going to be really exciting and a really great program that we've all worked a long time on. But any last burning questions before we move on?
I have a quick question, Sarah. Hi, Johnny Ota. Is the east side, have you secured the spot for the east side of the mountains?
Potentially, yes. We do have a apparent successful bidder at this point.
Okay, great. Thank you very much.
Yep.
So West Side Friends, come on.
We're working on it. Brainstorming.
Yep. All right. And with that, I'll just check this. Paul, I'll get you all the information. Thanks for coming. Happy to see you on here too.
Oh,
right.
also, if you guys can't think of any questions now, but later on, you're able to think of additional questions. On the procurement, there is a web or email address that you can email regarding your questions about the bid for the west side of the state, and we will answer accordingly, and then we will post that question up so that other bidders from the west side can also see it too as well. So if you don't have any questions now or can't think of anything, but later on you do have questions on the bid, on the procurement bid, it does have an email address to email it to, and then we'll answer it accordingly for you guys as well. So.
Great. And then just one more comment before we move on. I want to just assure everybody on here, because I'm seeing the chat. Rachel and I will work together. I will make sure every single person on this call and who's actually just a member of the Bridge Coalition, which is a lot larger than those here today, get all this information. So it's really clear. You'll have, the presentation, the slide decks, the emails. I'll make it clear and easy. And again, a special thanks to HCA. This procurement for the west side is going to be easier than the first go around. So I think that's a real plus here for the timing of this. All right. And with that, MJ, I'm going to go ahead and pass it to you. We have a presentation that I'll let MJ tell us about. And I'm going to stop the recording.